Hands make dreams real. Since January of 2006, over 175 pairs of hands have worked together to plan, organize, and renovate so that free health care is available to the uninsured working poor of our community. Healthcare professionals and community leaders alike knew the need was great. Local pharmacist and State Representative Chris Jones understood the need well.
As a pharmacist on a daily basis, I see the need in the community. A lot of people don't realize how many people are out there who can't afford to go to the doctor, who can't afford when they go to the doctor to have their medicines filled and pick them up. I think the biggest challenge is for those families who are working. People think they don't need any help, but they're the ones who mainly do need the help because they're what I would call the working poor. They're going to work, sometimes they're working 1 and 2 jobs, and just try to make ends meet. I think the benefits to the business community are many. The first one that comes to mind is that there are employees who need the medical care, or the family members of that employee that needs medical care can get it. They can get the test run that they need, they can get the medications that they need, and they can be seen by the doctors that they need to be seen by. And what that means immediately, I can tell you as an employer, fewer days out of work means more productivity, which means that you're providing that service to the community, whether if you're a manufacturing plant, or if you're a hospital, or if you're a pharmacy, or if you're a law office. You're taking care of the people that need to be taken care of. And with better productivity, then what you have at the end of the day is a more profitable business. And the business model that we have in this country is that those who are more fortunate, I think, are required and should give back to the community. So to whom much is given, I think much is expected.
On June 21st, 2007, we began seeing patients here at 3000 Godwin Boulevard for the very first time. By late fall, we boasted a patient load of over 340 and add 100 new patients every month. Dr. Bernard Jameson is one of our volunteer physicians who has blessed us with his healing hands.
Why do we need a free clinic? Well, we need it because we have a huge number of people in this area who have no real access to health care. They have no insurance, they really don't have the finances to go to a private physician, and many times they end up in the emergency room, which is not a really good way to handle basic day-to-day medical problems.
Many people in our community are forced to make difficult choices every day, choosing between buying groceries for their children or filling their life-saving medications. This is a need familiar to Dr. Terry Babineau, who has established and worked in free clinics for years. Dr. Babineau is now a volunteer physician at Western Tidewater Free Clinic.
The impact that the free clinic has on our patients really can't be overstated. It's truly amazing that so many of the folks that come in here to see us have not seen a physician in over 20 years. We see it every single day. Here we are in the United States of America in the year 2007, and many of our community citizens are not seeing physicians. We're not in a third world country, we're right here in Western Tidewater.
The Western Tidewater Free Clinic is pretty much dependent on volunteers. We only have one paid position or nurse, so we need all volunteer nurses to run our clinics. We have those in the evening and during daytime hours, and we use about 6 to 9 nurses each week. So the need is great. We very much need physicians, internal medicine specialists, and family practice doctors run our clinics. We have many who are very committed and are so helpful to running our clinic, but we need more. We have, again, the evening clinics. We use 2 or 3 physicians per night. We have morning clinics, and we want to add more daytime hours to accommodate people's needs. So we need many more physicians. As well, we need some medical specialists who are willing to see patients in their offices when our clinic physicians make a medical referral. We certainly need volunteers who aren't nurses and doctors. We have a need for eligibility clerks who help screen patients, potential patients, for their eligibility. They receive training for this, of course. We need receptionists, we need data entry clerks, and we need office assistants. The need for general volunteers is as great as the medical people.
I'm April Knight. I'm the Executive Director of Western Tidewater Free Clinic. I think perhaps one of the most powerful things that this clinic provides is hope. I've seen patients walk through the door, guarded, drawn in on themselves. One woman in particular was raising up her granddaughters and her great-granddaughter, but she came here with diabetes. She'd not had insulin for a year. She'd not had any treatment for a year. She was losing her vision. She was losing feeling in her feet. Yet she was committed to raising these girls up through her faith community, seeing them through college and their weddings. But she wasn't sure she was going to live to be able to see that dream. She left the next night after seeing a physician with insulin and a glucose meter, follow-up labs, and the next time I saw her, truly, she was transformed because she knew she was going to be alive to raise these children and this one great-granddaughter. And that's hope, and that's what we do best. And imagine the good your hands could do, joined with ours.